Steph and Amanda, and we're doing feline oral resorptive lesions.
Resorption is the gradual destruction of a tooth or teeth caused by cells called odontoclasts.
Oral resorptive lesions are found in 30 to 40% of adult healthy cats and are most commonly found in purebreds such as Persians and Siamese.
Resorption is the process in which a structure loses substance and is eventually remodeled. Resorption starts at the outside of a tooth at the gum line. The condition is common in premolars in the lower jaw but can occur in any tooth.
Resorption is obvious. It looks like the gum tissue is growing into or over the tooth. It can also appear that there is a hole in the tooth, which is why the condition is sometimes referred to as a cavity. Less visible resorptions can be found using magnifying devices and lighting once the cat is anesthetized, but tooth resorption under the gum line must be diagnosed using X-rays.
Resorption is a progressive disease, which first erodes the cementum or surface layer of the root, and then the dentin, which is the hard tissue just below the enamel of the tooth. It then moves to the center of the tooth and the pulp, which is comprised of living connective tissue and cells.
The resorption process continues into the fluid-filled dentinal tubules, tiny channels that spread outward through the dentin to the cementum. Then the enamel is resorbed, which can cause the tooth to fracture or remodel into a lump on the gum line. Resorbed cementum and dentin is replaced with hard, bone-like tissue. Symptoms for feline tooth resorption can be drooling, have bleeding from the mouth, or difficulty eating. Occasionally there can also be some vomiting of unchewed food, behavior changes, and bad breath. Feline tooth resorption is a painful condition, but your cat usually won't show. What's that look?
The fifth stage, only remnants of the tooth remain, covered by gum tissue. Most of the tooth has been resorbed, leaving only a raised area on the gums. 5 stages. The first stage is mild hard tissue loss, either cementum or both enamel and cementum. In this stage, usually only a defect in the tooth's enamel is all that's noticed. There is also no sensitivity yet because the disease hasn't hit the dentin yet. The second stage, moderate hard tissue loss and loss of dentin that hasn't reached the pulp yet. In the third stage, there's deep hard tissue loss, loss of dentin that leads to the pulp chamber. In this stage, most of the tooth is still viable. In the fourth stage, extensive hard tissue loss, most of the tooth has lost integrity. A lot of the tooth's hard structure has been destroyed. This stage has 3 subcategories. In the first subcategory, the crown and root of the tooth are equally affected. In the second, crown is more severely affected than the root. And third, the root is more severely affected than the crown.
Feline tooth resorption is a very painful condition, though usually cats won't show that they're in any pain.
Extraction of a tooth undergoing resorption is the only treatment. Extraction can be a difficult procedure to perform because affected teeth are usually fragile and can often fracture and splinter during removal. X-rays are taken to visualize fractured tooth fragments. The entire tooth and all fragments must be removed to prevent infection.
For this disease would be to brush your cat's teeth often. Also, it's recommended to get twice yearly dental X-rays for screenings of any additional lesions. Thanks for watching.